That searing ache in your knees before your feet even hit the floor. Shoulders so stiff you can barely reach for your alarm. Is this just getting older? Or is that morning joint pain a silent alarm? A serious warning sign your body is desperately trying to send? Forget just groggily accepting this as your new normal. That discomfort could be the first whisper of something much bigger, and ignoring it isn't an option if you want to keep living fully. We're about to find out exactly what your body's trying to tell you. Section 1. The unwelcome wake-up call, understanding morning joint pain. Waking up should feel refreshing, right? A reset. But for millions, it's an immediate reminder of discomfort, a battle before the day even truly begins. That stiffness, that ache, that tenderness in your joints first thing in the morning, it's more than just an annoyance. It's a specific symptom known medically as morning stiffness, and how long it lasts and how bad it feels can tell a really important story about your health. So many people brush it off. Oh, I just slept wrong. It's probably just a bit of chill in the air. And you know what? Sometimes that's true. But what if it's happening almost every day? What if it's taking longer and longer to walk it off? This isn't just about a bad night's sleep. This could be your body's way of saying, hey, I need some help. It might be pointing to underlying issues that need attention, issues that could mess with your mobility, your energy, and your overall quality of life if you don't address them. The frustration is completely real. You want to leap out of bed or at least get up without a 10-minute warm-up routine filled with creaks and groans. You see others starting their day with ease, and you can't help but wonder, why me? What's going on? Feeling like your own body is betraying you, especially right at the start of the day, can be incredibly demoralizing. It can cast a shadow over everything, making you dread mornings instead of looking forward to them. We get that, and that's why we're going to break this down, because understanding is the first step to taking back control. It's time to move past the frustration and get to a place of knowledge and action. Is it simply a mechanical issue, or is it a sign of something more systemic? Something that needs a specific plan. Section 2. When it's not the big scary stuff, common culprits for morning aches. Okay, before we dive into the more serious conditions, let's be clear. Not all morning joint pain means there's a 5-alarm fire. Sometimes the cause is a lot simpler, more related to our daily habits or even our bedroom. Figuring these out can bring some quick relief and definitely save you some unnecessary worry. One of the most common culprits? Simply how you sleep. Poor sleep posture is a huge contributor. If your neck is at a weird angle, your spine isn't aligned, or your arms and legs are twisted up for hours, you're basically putting your joints in a prolonged stress position. Your mattress could also be the sneaky enemy here. An old, sagging mattress, or one that's too hard or too soft for you, just won't give you the support you need. That leads to pressure points and misalignment, which then show up as morning pain and stiffness. And don't forget your pillow. It plays a big part, especially for your neck and shoulder comfort. A pillow that's too flat or way too thick can really strain your neck. Then there's the simple fact of not moving much overnight. When you're asleep, you're not moving around a lot. This lack of movement can cause the synovial fluid, that's the lubricant in your joints, to get a bit thicker. Muscles and ligaments can also tighten up. So when you first try to move, everything feels stiff and restricted until you get moving and help warm things up and get that fluid flowing more freely again. This is often why the stiffness tends to get better after you've been up and about for a little while. Believe it or not, the temperature of your bedroom can also play a role. Cooler temperatures can sometimes make stiffness in muscles and joints feel worse. While it might not be the main cause, a cold room can certainly make any existing sensitivities more obvious. Think about how your body tenses up when you're cold. Your joints aren't much different. Even something like dehydration can be a sneaky factor. Your cartilage, the cushion in your joints, is actually made up of a lot of water. If you're consistently not drinking enough, your cartilage might not be as plump and resilient, and that could contribute to discomfort. So if your morning stiffness is pretty mild, goes away within about 10 to 15 minutes of moving, and you don't have other worrying symptoms like major swelling or redness, it's definitely worth looking into these lifestyle factors first. A new pillow, a better mattress, some gentle stretches before bed, or making sure your room isn't too chilly could make a surprising difference. But what if it's more than that? What if that stiffness just clings to you for much longer? Section 3, the wear and tear reality osteoarthritis in your mornings. All right, let's talk about one of the most common reasons for that persistent morning joint pain, especially as we get a bit older. Osteoarthritis, or OA, as it's often called. If your morning joint stiffness usually eases up within about 30 minutes of getting yourself moving, osteoarthritis might be the condition that's whispering, or sometimes even shouting at you. Osteoarthritis is often described as wear and tear arthritis, and it's the most common type out there. Picture the cartilage in your joints, that smooth, slippery tissue that cushions the ends of your bones and lets them glide over each other without any trouble. In OA, this protective cartilage gradually breaks down. As it wears away, the bones can start to rub more closely against each other, and that leads to pain, stiffness, and not being able to move as easily. Along with the cartilage breaking down, the synovial fluid that lubricates the joint can also decrease in amount and quality. So, why does this often feel worse in the morning? Well, after a period of rest, like a night's sleep, your joints haven't been moving. That, combined with the already compromised cartilage and less lubrication, can make those first movements feel particularly stiff and uncomfortable. Think of it like an old rusty hinge. It needs a bit of oil and some movement to get going smoothly. Once you start moving, you encourage the flow of that synovial fluid and gently stretch the tissues around the joint. That's why the pain and stiffness in OA usually get better or even go away within about half an hour. The joints most often hit by OA include the knees, hips, hands, and spine. You might notice a kind of grating sensation when you move the joint, or maybe some mild swelling after you've been active for a while. The pain from OA often creeps up slowly and can get worse over time. It might be an achy pain and can be made worse by activity, but that relatively short period of morning stiffness is a key characteristic. While getting older is a primary risk factor, OA isn't just an old person's disease. Previous joint injuries, being overweight, which puts extra stress on weight-bearing joints like your knees and hips, a family history of OA, and even overusing certain joints can also contribute to it developing. It's important to know that while OA does involve degeneration, it's not just a passive thing happening. There's also a low-grade inflammatory part to it, though not nearly as much as in other types of arthritis we'll get to. Catching OA early is really helpful because while we can't reverse the cartilage damage, there are many ways to manage the symptoms, slow it down, and help you keep enjoying your life. Section 4. When your body attacks itself, rheumatoid arthritis and prolonged stiffness. Now, what if your morning joint pain is a different beast altogether? If it's an intense, deep-seated stiffness that pretty much locks you up for an hour, or sometimes even longer, then we need to talk about a more serious category, inflammatory arthritis. And one of the most well-known conditions in this group is rheumatoid arthritis, or RA. Unlike osteoarthritis, which is mainly that wear and tear on your joints, rheumatoid arthritis is an autoimmune disorder. This means your body's immune system, which is supposed to be your defender against infections, mistakenly starts attacking your own healthy tissues. Specifically, it goes after the lining of your joints, called the synovium. This attack causes inflammation, and that leads to swelling, warmth, redness, and a lot of pain in the affected joints. That prolonged morning stiffness, often lasting more than an hour, is a classic sign of RA. This isn't just a little bit of creakiness. It can be truly debilitating. Simple things like buttoning a shirt, opening a jar, or even gripping a toothbrush can feel like huge efforts. The joints most commonly affected are often the smaller ones in your hands and feet, and typically in a symmetrical pattern. So if one wrist is affected, the other one often is too. However, RA can also hit larger joints like your knees, elbows, and shoulders. But RA isn't just about joint pain. Because it's a systemic disease, meaning it affects your whole system, it can impact other parts of your body too. Fatigue is a very common symptom, and it can be absolutely overwhelming. Some people might also experience fever, lose weight without trying, or develop rheumatoid nodules. Those are firm lumps under the skin, often near joints like the elbows. In some cases, RA can also affect organs like the eyes, lungs, and heart. We don't fully understand what causes RA, but it's thought to be a mix of genetic predisposition and environmental triggers, like certain infections or even smoking. It can show up at any age, though it most commonly starts between 30 and 60, and it tends to affect women more often than men. If this description of really long, severe morning stiffness, often with swelling and affecting multiple joints on both sides of your body, sounds familiar, it's really important to see a doctor. Getting an early diagnosis and starting aggressive treatment for RA are vital to control the inflammation, prevent permanent joint damage and deformity, and manage the disease's effects on your whole body. Ignoring these signs lets the disease get worse, and that can lead to significant disability. This is a warning sign your body is practically screaming, and it absolutely needs to be heard. Section 5. More immune system mischief, psoriatic arthritis, and ankylosing spondylitis. Rheumatoid arthritis isn't the only autoimmune troublemaker that can unleash significant morning joint pain and stiffness. There are a couple of other important types of inflammatory arthritis you should know about: psoriatic arthritis, PSA, and ankylosing spondylitis, AS. Both of these can make mornings particularly tough. Let's start with psoriatic arthritis. As the name hints, PSA is often connected to psoriasis, that chronic skin condition causing red, scaly patches. But here's the thing, not everyone with psoriasis will get PSA, and sometimes the joint problems can even pop up before any skin changes do. Just like RA, PSA is an autoimmune condition. Your immune system mistakenly attacks healthy joint tissue, leading to inflammation, pain, swelling, and that familiar long-lasting morning stiffness, often sticking around for more than an hour. PSA can hit any joint in your body, and it can show up in different ways. Some people might have symptoms similar to RA, with small joints affected on both sides of the body. Others might only have a few joints involved, often asymmetrically, meaning not the same on both sides. A pretty unique feature of PSA can be enthesitis. That's inflammation where tendons or ligaments attach to bone. This commonly causes pain at the back of the heel or the sole of the foot. Another telltale sign can be dactylitis, often called sausage digits, where an entire finger or toe swells up. Nail changes like little pits or the nail separating from the nail bed are also common if you have PSA and skin psoriasis. Then there's ankylosing spondylitis, or AS. This is a type of inflammatory arthritis that mainly goes after the spine, though it can also affect big joints like the hips and shoulders, and sometimes even the heels. The classic symptom of AS is chronic inflammatory back pain and stiffness. It's typically worse in the morning or after you've been inactive for a while, and it often gets better with movement or exercise. This morning stiffness can be really profound and hang around for a long time. In AS, the inflammation usually starts in the sacroiliac joints. Those are at the base of your spine where it meets your pelvis. Over time, this inflammation can lead to something called ankylosis. That's when new bone forms as your body tries to heal, causing sections of the spine to fuse together. This fusion can lead to a loss of flexibility and a hunched posture if it's not managed well. Like other systemic inflammatory conditions, AS can also bring on fatigue and sometimes inflammation in other parts of the body, like the eyes, uveitis, or, less commonly, the heart and lungs. AS tends to pop up in late teens or early adulthood and is more common in men. So, for both psoriatic arthritis and ankylosing spondylitis, if you're dealing with that stubborn morning stiffness that lasts over an hour, especially if it comes with skin psoriasis, specific patterns of joint pain, or persistent inflammatory back pain, these are serious warning signs. It's definitely time to get checked out by a doctor. Early intervention is so important for managing these conditions and preventing long-term joint damage and disability. Section 6, decoding the signals. When is morning pain a red flag? Phew! We've covered a lot of ground, from simple sleep issues all the way to serious autoimmune conditions. So how do you cut through all that information and figure out if your morning joint pain is just an annoyance or a genuine red flag that needs immediate attention? Let's quickly recap the key warning signs that tell you it's time to stop guessing and start talking to a healthcare professional. The first big one is the duration of stiffness. If your joints feel stiff for more than 30 minutes after you wake up, and especially if it lasts for an hour or even longer, that's a significant clue. It could mean an inflammatory process like rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis is at play. Stiffness from osteoarthritis or just from being inactive usually eases up much quicker, typically within 10 to 30 minutes. Next, look for visible signs of inflammation in your joints. We're talking about swelling, redness, or a feeling of warmth when you touch the affected joint. These are classic signs that your immune system is in overdrive in that area, a common feature of inflammatory arthritis. Osteoarthritis might sometimes cause a little mild swelling, but noticeable redness and warmth are less typical. Think about the intensity and persistence of the pain. Is the pain bad enough to mess with your daily activities or wreck your sleep? Does it seem to be getting gradually worse over weeks or months? Is it a pain that doesn't really improve much even after you start moving around? While some discomfort is one thing, persistent, disabling pain is a clear signal your body needs help. Pay attention to how many joints are affected and the pattern. Inflammatory conditions like RA often affect multiple joints, frequently in a symmetrical pattern, so both knees or both wrists. PSA can be symmetrical or asymmetrical. OA might affect one or several joints, but the pattern can vary a lot. Finally, are there any accompanying systemic symptoms? We're talking about unexplained fatigue that's more than just feeling tired, a low-grade fever, losing weight without trying, or symptoms in other parts of your body, like skin rashes if you have psoriasis or eye inflammation, which can happen with AS or RA. These are all important pieces of the puzzle that could point towards a more systemic issue. If any of these red flags are waving at you, please don't try to self-diagnose or just tough it out. Schedule an appointment with your doctor. Getting an early diagnosis and the right treatment can make a world of difference in managing these conditions, preventing long-term damage, and keeping your quality of life high. Your doctor can do a physical exam, ask you detailed questions about your symptoms, and order tests like blood work or imaging to really get to the bottom of what's causing your morning joint pain. Taking that step isn't a sign of weakness, it's a sign you're taking control of your health. Section 7, fighting back practical at-home strategies for pain-free mornings. Understanding what might be causing your morning joint pain is important, but what you really want to know is how to fight back against it, right? Well, the good news is there are many practical things you can start doing at home to help manage that morning stiffness and discomfort. This is true no matter the underlying cause, though these tips are especially helpful for general stiffness and osteoarthritis. Let's start with what you can do before you even think about getting out of bed. Gentle stretching and range of motion exercises are your first line of defense. So instead of trying to leap, or let's be honest, creak straight up, take a few minutes to gently wake up your joints. While you're still lying on your back, slowly bend and straighten your knees. Gently rotate your ankles and wrists. Flex and extend your fingers. Slowly turn your head from side to side. These simple movements help lubricate the joints, get your circulation going, and loosen up those stiff muscles and ligaments, making that transition from bed to standing much, much smoother. Heat therapy can be a total game changer for stiff, achy joints. Applying warmth helps relax your muscles and increases blood flow to the area, which can seriously ease stiffness and pain. You've got a few options here. A warm shower or bath first thing in the morning is a fantastic way to soothe your entire body. If you don't have time for a full shower, try using a heating pad on those particularly stiff spots like your back, shoulders, or knees for about 15 to 20 minutes. This can give you some really targeted relief. Some people even find electric blankets helpful to keep their joints warm through the night, which might reduce how bad that morning stiffness feels. Next up, take a good hard look at your sleep environment. We touched on this earlier, but it's so important it bears repeating because it's fundamental. Your mattress should give you good support and keep your spine in a neutral alignment. If it's old and sagging, chances are it's contributing to your pain. Similarly, make sure your pillows are right for your sleeping position. They need to support your head and neck properly to prevent strain. Don't be afraid to experiment with different pillow types or even body pillows if you find they help you stay in a more comfortable, joint-friendly posture all night long. Small adjustments here can make a surprisingly big difference in how you feel when that alarm goes off. These simple, gentle morning rituals can really set a more positive tone for your entire day. They help reduce that initial wall of pain and stiffness and let you move more freely sooner. Section 8. Fighting back practical at-home strategies for pain-free mornings. Beyond your immediate morning routine, your overall lifestyle choices play a massive role in managing joint pain and stiffness. Seriously, what you do throughout the day can significantly impact how you feel when you wake up. One of the most powerful tools you have is staying active. Now, it might seem counterintuitive when your joints are hurting, but regular appropriate exercise is so important for keeping your joints flexible, strengthening the muscles that support them, and actually reducing pain in the long run. The key is to choose low-impact activities that are gentle on your joints. Think things like walking, swimming, water aerobics, cycling, yoga, or Tai Chi. These activities help nourish your cartilage, improve your range of motion, and can even help with weight management. And that means less stress on weight-bearing joints like your knees and hips. You know that saying, motion is lotion? It truly applies here. Consistency is way more important than intensity, especially when you're just starting out. Your diet also really matters. While there's no single magic food that will cure joint pain, adopting an anti-inflammatory eating pattern can help reduce overall inflammation in your body, which can definitely benefit your joints. Generally, this means focusing on whole, unprocessed foods. Load up on fruits and vegetables, especially berries, leafy greens, and brightly colored veggies. Fatty fish that are rich in omega-3s, like salmon and mackerel, nuts, seeds, and whole grains. Try to cut back on processed foods, sugary drinks, red meat, and unhealthy fats, as these can actually promote inflammation. Also, making sure you eat a nutritious breakfast can help energize your body and get it ready for movement. And please don't forget hydration. Drinking enough water is super important for your overall joint health. Something else to consider is the timing of your medications. If you take any for arthritis or pain, some people find it really helpful to take their prescribed arthritis medication as soon as they wake up, maybe even keeping it by their bedside with a glass of water so it starts working before they even try to get out of bed. This can help lessen how severe those morning symptoms are. Of course, always follow your doctor's instructions about when and how to take your medication. These lifestyle adjustments, regular gentle movement, a supportive diet, and smart medication management all work together to help you fight back against morning joint pain. They empower you to take an active role in your well-being, transforming you from someone who just puts up with pain into an active manager of your own health. Section 9. Knowing when to call in the professional's medical help and management. While all these at-home strategies are incredibly important, there are definitely times when self-care just isn't enough, and you really need the expertise of healthcare professionals. Recognizing when to seek medical advice is just as important as knowing what stretches to do in the morning. So, when is it time to make that call? Well, if your morning joint pain keeps hanging around for more than a few days, even though you're trying these home care tips, if it's severe, or if it comes with those red flag symptoms we talked about earlier, like stiffness lasting over an hour, significant swelling, redness, warmth, or those systemic symptoms like unexplained fatigue or fever, then you really need to get a medical evaluation. These could be signs of underlying conditions like rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis that need specific medical treatment. Your primary care doctor is usually the first person to see. They can check out your symptoms, do an initial examination, and may order blood tests to look for signs of inflammation or specific antibodies. They might also suggest imaging tests like X-rays or ultrasounds to get a better look at your joints. Based on what they find, they can make a diagnosis or refer you to a rheumatologist. That's a doctor who specializes in arthritis and related conditions. Once a diagnosis is made, your doctor will talk with you about what medication management plan that's tailored specifically to your condition. For osteoarthritis, this might involve pain relievers like acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs. For inflammatory arthritis like RA or PSA, the treatment is more complex and often involves disease-modifying anti-rheumatic drugs, DMARDs, or biologic agents. These work to calm down that overactive immune system and prevent joint damage. Taking these medications exactly as prescribed is so critical for controlling your condition and minimizing those morning symptoms. And please don't underestimate the value of working with therapists. Physical therapists can create customized exercise programs to help you improve your strength, flexibility, and range of motion, and they can teach you how to move in ways that protect your joints. Occupational therapists are experts in helping you adapt daily tasks to make them easier and less painful. They can recommend assistive devices, splints, or changes to your home or work environment to help you function better and reduce strain on your joints. This can be particularly helpful for managing morning stiffness and just getting your day started more comfortably. Remember, seeking professional help is a proactive step towards better health. It means you get an accurate diagnosis, the right treatment, and a complete management plan that can significantly improve your quality of life and help you conquer that morning joint pain. If this information has been helpful and you've learned something valuable about your morning joint pain, please give this video a thumbs up. It really helps our channel reach more people who might be silently suffering and looking for answers. And don't forget to subscribe and hit that notification bell. That way, you won't miss out on our future videos, which will be packed with more health insights and actionable advice to help you live your best life. We'd also love to hear from you. Are you experiencing morning joint pain? What strategies have you found helpful? Share your experiences and any questions you have in the comments section below. Your insights could really help someone else in our community. And if you know someone who wakes up stiff and sore, please consider sharing this video with them. It might just be the information they need to start finding some relief. Waking up with stiff, aching joints doesn't have to be your destiny. As we've explored today, that morning discomfort can range from a simple consequence of your sleep habits all the way to a critical warning sign of an underlying medical condition like osteoarthritis or an inflammatory arthritis. The most important thing is to listen to your body, understand the potential causes, and know when those symptoms are signaling something more serious. Remember those red flags: morning stiffness that lasts longer than 30 to 60 minutes, persistent joint swelling or warmth, and pain that significantly messes with your life. These are your body's cues to seek professional medical advice for an accurate diagnosis and an effective treatment plan. But remember, knowledge is power, and so is action. From gentle morning stretches and using heat therapy to optimizing your sleep, staying active, and eating a balanced diet, there are so many proactive steps you can take to manage your symptoms and fight back for pain-free days. Early recognition and a comprehensive approach, combining lifestyle changes with medical support when you need it, can dramatically improve your outcomes and your daily quality of life. Thank you so much for joining us today. We really hope this has empowered you to take control of your morning joint health